So we'll start with the spectrum, and this is, like I said earlier on, this is the one disease which does have a precursor disease state. And what is that precursor disease state? It's MGUS. It's mono. And what does MGUS mean? MGUS is essentially monoclonal gammopathy of undetermined significance. And the word MGUS itself tells you that we don't know a lot about MGUS. We're calling it of undetermined significance, and maybe over the next few years we will identify who are the MGUSs with significance, and we will stop calling those MGUS. And that's what I mean by understanding better risk stratification. But in essence, for most people to understand is, as long as you have a monoclonal protein but you do not have any other features of myeloma, such as bony related problems, kidney related problems, anemia, infections, and so on and so forth, you will be categorized as MGUS. And then we have certain supplemental things that we do in terms of a marrow testing, where you have less than 10% plasmacytosis, where you will not have any evidence of bone disease on good imaging, and those would be the true MGUS patients, and those are patients who need to be followed but not necessarily intervened upon. And then at the other end of the spectrum, you have what we call symptomatic multiple myeloma, or even multiple myeloma with evidence which is going to become symptomatic quickly. That means biochemical evidence of end organ damage. So that imaging, for example, if it shows bone related problems, you're not going to wait for somebody to become symptomatic, but you're going to go in and treat. And that's the definition of multiple myeloma. In between, you have this whole range of patients who we call smoldering, and I don't like that term. Smoldering sounds like, who knows what's going to happen next. I think that's the patient population we need to better understand, and we need to better categorize and put them in these two buckets so that there's no confusion on treatment, no treatment. Now, ideally, that smoldering space has all the characteristics of myeloma without any end organ issues. No symptoms, nothing on imaging, no kidney issues, no biochemical evidence of sort of end organ damage. And those patients should be watched and should be followed pretty closely. If you want to treat them, that's perfectly reasonable. There's a lot of clinical trials out there, and I would urge your patient folks to reach out and look for different clinical trials and really understand why it is that they're getting treated. But that's kind of the spectrum of the disease.